And we understand certain molds can be allergenic from that standpoint. In fact, if you have a histamine response to molds, then just about any mold can do that to you. But it's these molds that produce these toxins that can help create some of the chronic issues. So I think that's a very solid test. I've worked with Dr. Hooper at Real Time Labs for years. In fact, as you probably know, I sat on their board. We actually have a patented process for removing the mycotoxins from the structure and the contents. And we can talk more about that later on. But that's kind of what we specialize in. So that environmental mycotoxin testing, there's actually several companies now that do that. Besides Real Time, there's a couple other labs that do that. So I think that's absolutely.
You've tried everything. You've changed your diet, you've detoxed, you've even moved homes, and yet you still feel sick. Headaches, brain fog, fatigue that no one can explain. What if it's not you? What if it's your environment? Welcome to Mold, Mycotoxins, and More. I'm John Bodie. Each week, I sit down with experts uncovering how mold, mycotoxins, and environmental exposures affect your health and what real recovery looks like. Let's get into today's conversation. The information provided on the Mold Pros podcast is for educational and informational purposes only and is not intended as medical advice, diagnosis, or treatment. Listening to the podcast does not create a doctor-patient or professional-client relationship between you and the podcast host, guest, or the Mold Pros. The content shared should not be used as a substitute for professional medical advice, diagnosis, or treatment. And always seek the medical advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition, potential mold exposure, or health concerns. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. And while we strive to provide accurate and up-to-date information, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, or suitability of all the information discussed. And guest experience and outcomes discussed on this podcast are individual cases and should not be considered typical results. Your situation may differ significantly. As always, if you think you have a medical emergency, call your doctor or 911 immediately. By listening to the Mold Pros podcast, you acknowledge that you understood this disclosure.
What if the air inside your home is affecting your health and you don't even know it? What if you've been told your home is fine because air tests came back normal, yet you or your family are still struggling with brain fog, fatigue, allergies, sinus issues, or other chronic symptoms? And how do you know if you really have a mold problem? And is air sampling enough? And most importantly, how do you know if the company you're hiring truly understands the needs of someone with mold-related illness? Today, we're going to answer these questions and more with Dr. Myra Reed, a board-certified internal medicine physician and certified functional medicine practitioner who has helped countless patients uncover the environmental factors contributing to chronic illness. So if you've ever wondered whether your home could be making you sick or how to find the right answers, this is an episode you won't want to miss. Welcome back to Mold, Mycotoxins, and More. I'm your host, John Bodie, co-founder of the Mold Pros, where we help physicians, patients, and homeowners understand how indoor environmental conditions can impact your health. Today's guest, Dr. Myra Reed, has spent more than 3 decades helping patients uncover the root cause of chronic illness. Inspired by her parents, who were both physicians, Dr. Reed earned her medical degree from Louisiana State University and completed residency at the University of Texas. As an Oklahoma fan to SEC schools I'm not the biggest fan of, but great institutions nonetheless. She founded her own practice in 2001 with a vision of providing more personalized, patient-centered care. And in 2015, transitioned to a concierge model that allows her really to spend more time with her patients. And in 2017, she became certified in functional medicine, combining traditional medicine with advanced diagnostic testing to help patients identify the underlying factors, including environmental exposures that may be contributing to chronic health conditions. Today, Dr. Reed serves patients throughout the Florida Panhandle and is passionate about helping people achieve lasting wellness through personalized root cause medicine. Dr. Reed, it's a pleasure to have you on the show. Welcome.
Thank you, John. I'm excited to be here. This is such a niche topic for me, and so well that we need to explain to people what's going on so people have an understanding.
You bet. So we're glad that you carved out time. I'd really like to start by learning more about, or having you share a little more about yourself and your practice. Growing up in a household with both parents being physicians. And I'm really interested to learn, and I think our audience would be as well, your transition from traditional internal medicine to functional medicine.
Yeah, so exactly. Both of my parents were small town physicians. My dad was a general surgeon and my mom general practitioner, but she delivered babies, helped my dad in surgery. And so growing up in this small Cajun town, Southwest Louisiana, we just saw how medicine was practiced. People knew each other, and my parents would help each other out. Like the patients would come by the house, or there was just that good personalized medicine. So I knew that I was going to go into medicine, and then of course going to traditional training, ended up in internal medicine, and I loved it. I was doing great. Opened my own practice, started seeing patients and spending time with them. But then I could start seeing how medicine was changing and how insurance was starting to dictate that you had shorter time to see patients and only one, maybe three at the most, if you were lucky, problems, given that pill for an ill approach. And I was like, I can't do this. This is not the way I grew up. And I love to give that small town medicine approach. And even though I was looking at this, I started saying, well, there's another model that I heard about where people can do what it's called a concierge or personalized medicine. It's a membership. And people who really want to really invest in their health for the long term and have that personalized care, plus the access, the longer appointments, less medications, and less specialists. I was like, this is the way I want to practice medicine. And this is the way I grew up. So I like to say I do the small town approach using modern day technology, because I'm a lifelong learner and I'm always, every day, like piqued interest of what's happening next. So during my transition in 2015, going into concierge, I went to a conference and heard these brilliant doctors talking, Dr. Mark Hyman, Dr. Bland. I mean, there's just on and on. And I was like, who are these people? They're talking my language. I didn't even know this existed. And it happened to be a functional medicine conference. And I was like, I want to learn everything I can about this, because this is speaking to me. So I jumped in right away and joined the ifm.org, which is the functional medicine program, and just started taking all the modules. And I rushed as soon as I could to learn as much and get through and get certified. So it takes 2 years. And so I took the certification and was an early certified in functional medicine. And then once I was certified doing all this, I, at another conference, heard Dr. Dale Bredesen, a neurologist in California, talking about reversing dementia. Now that really piqued my mind, because Dr. Bredesen, talking about as a neurologist doing this research, was using a functional medicine approach to reverse dementia. And because my mother, the brilliant physician, ended up getting Alzheimer's and dying of Alzheimer's, and I knew I was going to be next down that path because it runs in my family along with Parkinson's. Right. I'm like, I'm going to do everything I can to learn and prevent this. So, just things evolve, and one path led to another. And here I am all these years later, still doing the membership, helping people transform their lives, finding the root cause of why people are having problems instead of that pill for an ill. And it's like the way medicine needs to be practiced. So yes, I feel blessed that I've had this path, which helped me, because I had brain fog. And we can talk about that. So I knew I was really having a really hard time studying. And even though had really pushed through and did well, going through medical school and residency and all, it was a struggle because of the brain fog. So once I started learning about this, not only did I learn why my mom got Alzheimer's, but also why I was having brain fog and how to fix it. And one of the big things was mold. So going back to another thing is what happened, because I knew about Dr. Bredesen's program, I was learning about toxins, genetics, a lot of different inflammatory things that can happen in your body. And so I found out that I had high mercury. So I started really detoxing mercury. And then I started really learning about, that there's mold. But that was really kind of a harder one to really learn, because the CIRS is called SEERS program that Dr. Richie Shoemaker was doing. That was my first experience of learning about mold, what mold causes in the body, the inflammation, the damage that mold to our body. And so I did his program, which was very intense, learning and implementing and such. So I did learn all that. But then I came across Dr. Neil Nathan, who to me is, the world expert in mold and such a wise gentleman. He's written the 2 books that I highly recommend people read, Toxin or
I,
Tox.
yeah, I think that book is right there on my shelf. I think it is foundational. It's a, and
Yes.
he's a great guy. It's a lot of wisdom there for sure.
Well, he's really what my mentor in mold. And so I'm going to tell the story how I really started learning about mold is that, I was trying to figure out all these things, learning about functional medicine, learning about root cause, learning about gut health and how to detox and lifestyle and hormones and such, which is our foundational type things for functional medicine. But I'm going to really jump into really how I feel like I'm a mold expert is that in October of 2018, I live in the panhandle of Florida, which is the north part of Florida on the Gulf Coast. And in October 2018, we had a large hurricane, Hurricane Michael, that just totally devastated our community. It wiped out, it was a category 5. And if you could make it a 6, it really was a 6. But both of our hospitals were knocked out. All the nursing home, everything, it turned into where we had a MASH unit set up, a literally outside little tent outside of one of the hospitals. The hospitals were devastated. People were being life flighted by helicopter and ambulances. There was no communication though by cell phone. Cell phone towers were knocked out for 10 days. We had no water, no gasoline, no communication. We didn't know if people were dead, alive. We didn't know where people were. I mean, I think there was one cell phone service that was working, like AT&T or something. And a friend of mine who was in Louisiana, part of the Cajun Navy that goes and helps hurricane people, brought over gasoline and water and some cell phones. But that took like over a week. And then we started like putting our lives back together at that time. And everybody had roof damage, water damage from roof leaks. Trees were all knocked out. I'm just telling you, it was total devastation. And so when we started getting our lives back, I started noticing that people were getting sicker. They weren't feeling good, brain fog, gut issues, fatigue, sinus problems, coughing, respiratory, you name it. And so I started kind of looking at, well, what could this happen? What could this be? And then right after that, my daughter, who was living out in California, had to come home because, if it was October of 18, January of 19 is when COVID hit, pandemic. So my daughter came home from California like in February, March. Okay. And I'm going to mention in a minute what all was happening because we had some water damage. We weren't feeling good. I had some local mold inspectors come, insurance wanted to inspection. So I had on 2 different occasions. The first one was before she came home. No, 2 of them were both before she came home. And they both did air sampling and tested my home and said, oh, your home's fine. You don't have any mold. And I'm like, okay, well, fine. That's great. So when she came home in March, she's like, Mom, what's this black stuff coming out behind my cabinet in my closet? And we're like pulling, and we pulled the cabinet out. I had some workers here at the house. They pulled it out and there is black, wet, sticky mold. And please don't let anybody ever do this, but one of the construction guys got a fan to dry it, blew, and she's in there. I'm like, get out, get out, get out. This is even crazy, but I was on the phone with 2 of my girlfriends. One's in the UK. She's a functional nutritionist, and another one that's up in British Columbia. She's a functional, she's a Ritchie Shoemaker Sears mold certified doctor. We met in IFM and we would talk on WhatsApp every now and then. I happened to be on the phone when all this was happening. They're like, y'all get out of that house, get out of the house. But it was too late. We got exposed. And so then my daughter got so sick. She was in a fetal position on the sofa. I mean, literally, I'm not exaggerating, for a good week or more. And her stomach was hurting. She had headaches. She had brain fog because we didn't know this. But not only did we have the hurricane damage, but there was also a PVC pipe that had a hole drilled in it that had been leaking chronically from the bathroom up above. So you can imagine the bacteria and the black stachybotrys. And come to find out, once we got it tested, it was horrible. And this was not something that just happened. This happened before. So when these mold testers came and said that my house was fine, I hate to say it, but it was a lie. I mean, how can that be? Because this was a chronic leak.
Yeah. One of the things, we can dive into that a little bit deeper. There's so much there to unpack.
Yeah.
There's so many inspectors that we call them hunt jockeys. He's going to grab an air sample and leave. And that's one data point, which is a good data point. But molds like Stachybotrys, it's a those spores don't aerosolize very well, and so that's where a good inspection really comes into play, and surface sampling as well. So maybe one of the things we talk about as we have our conversation today is what type of testing is adequate, especially what type of testing for people that are mold sensitive or have mold illness. But that's just
Well, I'm going to tell you that, here we had two negative mold inspections turned into the insurance company. And then not only did we pull out and see the Stachybotrys, but when they came in and pulled the HVAC,
mhm.
the unit out, when you looked up, what do you ever call where the air goes up, the
Let 'em-
air ducts, the phlegm, I guess. I took pictures. It looked like cancer. It was black, and I mean, it was the grossest picture you've ever seen. And this is what we were breathing in for even for who knows how long, because both of them just looked cancerous. I mean, if I could send pictures to show, because a picture is 1,000 words, but this explains. My son was always having chronic sinus problems, and we all had gut problems, overgrowth, because mold loves to go in wet, moist, dark, warm areas. So, sinuses, gut. I mean, we can go into more, but even people who have recurrent, vaginal issues is mold induced. So any of these areas of the body are cavities. And if you're chronically breathing it in and don't even know it, you think you're living in a safe home, your life. And we're going to go into what mold can do to people more so than just what I just mentioned. But I can factually say that, yes, getting the right mold inspector is huge. And I hate to say it, but where we live up here, I mean, for years, since all this, I have not found reliable testers in our area. I've had to get people from Central and South Florida or North Carolina or different places, and it's just hard to set this up. And people are so sick, and they're talk about cause anxiety. I mean, mold can cause anxiety. And then once you tell them, then they're like totally freaking out. And, just like that's the problem where we live, was finding the right people to test it right.
if we could dig into that a little bit more, what that testing should look like, so that people don't have to live the experience that you live. But I think as a practitioner, having gone through that probably gives you a great perspective and ability to relate and understand and guide people through that process. So, the glass is always half full. There's a silver lining. Unfortunately, you went through that with your family, but it probably positions you very well to really take care of your patients in a way that you may not have been able to do to that level before.
You've cleaned, repainted, and replaced filters, and still, you're not getting better. Headache, fatigue, brain fog, the doctors can't explain it, but your environment can. At the Mold Pros, we specialize in uncovering what's hidden in plain sight. Our environmental testing looks beyond surface mold, identifying bacteria, volatile organic compounds, and even mycotoxins in the air that you breathe. Then we correlate those results with your clinical data, showing how your space may be affecting your health. Next, we use our patented remediation process to safely remove toxins, restore balance, and prevent them from returning. It's more than just a cleanup. It's a science-based system designed to help your body heal by healing the environment first. If you're ready to breathe freely again, visit themoldpros.com and schedule your free consultation. Because wellness doesn't start in the doctor's office. It starts where you live.
I agree. I think, and I believe that God puts things in our paths, struggles, so that we can learn and help other people. And I truly believe, this was, put in my path for a reason. And I do help people. And the one thing I had early on was hard, was convincing people that it exists, and that, like if a woman came in with brain fog, fatigue, all, hormonal problems, gut issues, weight issues, it affects all these things. And they've been, dismissed by other doctors. And even their spouse gets tired of hearing them and say, well, you've been to the doctor, all these doctors. And then they finally come to me, and I'm like, no, this is real. I believe you. This, you're not crazy. And that's one of the biggest things, is that people don't know why they don't feel good. And that's why I feel like, again, like, thank God, functional medicine came into my life when it did, and this path that I'm on really opened my eyes to saying, okay, people need to be believed, and make them feel like they're heard, and then show them that this can be tested and validated, because the spouses always say, well, show me, show me.
Mhm.
So I can say, okay, here's the test, here's the positives, it's not just me doing a woo-woo test. This is validated through true research, through true environmental agencies, and it's not it's definitely true science. And so I can, and you're going to talk about testing the home, and I know how to test people and then treat them and then get them better.
It's what's interesting. You said two things that are kind of interesting. You talked about inspectors that don't understand and do proper testing, and therefore giving you false negatives, right? And then you turn around and follow
Truly.
up with practitioners doing the exact same thing. And
Yeah,
so
these
there's a corollary there. So, question: when a new patient goes to your practice and walks into your office, they have these unexplained chronic symptoms that you mentioned before. How often does the conversation eventually lead to their home or workspace?
So the way my practice works now, I do a meet and greet with anybody who's interested in joining my practice. I want them to understand the value of what they're getting and what they're getting involved in. And I want to make sure that we're a good match.
Mhm.
So when people come in for the meet and greet, we sit down, I start asking questions, on and on. But one thing is, I love to gather so much information, and I ask everything. And so, okay, what are your symptoms? What's going on? What's your, what are you having issues with? And so once they start going through, and I ask them about their life, and about, family history, things, all these things. But then I'll finally ask, have you ever lived in a water damaged home? Has there ever been a water leak? Or do you think that you've ever lived in a place where there was mold? And they go, yes. And I'm like, because leading up their history, after I just sit there and do this brief meet and greet, like it's about 45 minutes long, but about as we get through everything, I'll ask them that. And they're like, yeah, and I'm like, well, do you think you're living in one now? Are you working in an environment? Are you exposed in any places, or was it in the past? Because a lot of people think you have to be living in it presently, which does make it worse, but you could have also been exposed in the past, like 10, 20 years ago, even. And because it'll go into your body and set up shop in some people. And there is a percentage of people that don't detox well. Everybody genetically is different. And so that's one of the things I look at. But I ask people, could this be a possible? And I don't say it is. I just say, and they're like, their eyes open, they peek, and they're like, never thought of that. No one's ever asked me that. And I'm saying, well, it's something we really need to dive into and look into and check. Because if it is, we need to find out when, where, how, and then start fixing this.
I think it's great that you do that. We do a similar thing. Is we get an intake. Tell me all about your home, your past water history, et cetera, water damage, et cetera. One of the things that we're all trained to do, especially when we go down this mold journey, is we talk about water damage buildings. I did a talk for it was Mold Congress, Dr. Shoemaker's conference years ago. Again, the focus is on water damaged buildings, and that's not necessarily correct. I think we need to go a little bit deeper because there are certain molds. You talk about Stachybotrys, but when we talk about Penicillium and Aspergillus and these xerophilic molds, they can thrive with just high humidity. And you and I both live in Florida. That's every day, especially in the South. It's every day we got high humidity, right? And so I think we need to start thinking about moisture affected buildings, maybe MAFs as opposed to WDBs, because if you have the EPA recommends ideally to keep your relative humidity between 30 and 50% in your home. And if you're consistently above that, then the odds of you having a xerophilic mold problem is pretty high.
Well, I agree with that, because you're right. And a lot of people think, well, and I don't mean to jump the gun, but I'm just one thing that people say, well, but I guess I just need to go live in Tucson or Arizona. And I'm like, do you realize that the number one guy with the ISEAI.org, which is our environmental
Mhm.
group that we're in, lives in Tucson? The number one, like there's the president of our organization lives in Tucson. So it's not necessarily, I love this because we do live in the Gulf Coast where the humidity is really high, especially all these condos that are right on the beach and everybody wants their doors open.
Right?
and it's just,
Mhm.
you have to be careful. And so people are like, well, where do I go live?
So when you guide a patient, and you say we talk, okay, there could be these environmental factors. How often do you see where you know sometimes folks like to take that ostrich approach, put their head in the sand and pretend it's not really an issue? Have you seen or experienced patients that didn't want to go down that rabbit hole or that trail, that journey to discover if their home does have contaminants and maybe it's impacted their ability to get on the road to recovery or wellness because of that?
Yes, yes, because people get scared. No one wants to leave their home.
Hmm.
It's hard to move. It's hard to renovate or remediate. And people are like, yeah, they'll fight everything they can. And they're like, well, where am I going to go? How would I find a safe place? And so people are, and it's really hard. That's really one of my biggest struggles. But if people are sick enough or uncomfortable enough, they'll probably do it. But one of the things that we know, and this is really something that we talk about in our groups, is that mold doesn't want you to leave the environment. So it messes with your brain, and as well as not just brain fog, but it also kind of makes you do that second guessing, like, well, maybe, being doubtful, like, well, could this really be? I don't know. I mean, maybe it's really not my home, you know, it, and they don't want to leave. And then the mold again, like I said, just messes with you because it wants you to stay in that environment. I mean, that's something we talk about. And I don't know if you've ever heard that, but a lot of people in our groups talk about how it's really hard to get people convinced always to either fix their home or move or do something about it. So, because you can't live in mold and get better.
Right.
And that's one of Dr. Nathan's first thing is, that's our first rule of thumb when you're treating mold is you can't be in, you got to get out of it, out of that environment. And that's one of my struggles is like trying to help people find a place. And we do have a lot of new construction around here that's, affordable new places or things like that. And people can like go somewhere else and then try to fix their home. But the problem is too, is insurance doesn't always like to pay that much for mold remediation either, which can be a problem. But yeah, trying to convince people that it's their home is really hard. I mean, just for example, I have a case that I'm seeing, someone that I know that's a patient. She's been in the community a long time and she lives in the top floor, the penthouse of a condo. Um, that had water damage from the hurricane in 2018. And I've been after her and her husband both. I'm saying, look, you're getting progressive dementia. She's had cancer because, mold decreases your immune system and sets you up for a lot of things, immune disruption. A lot of people get autoimmune as well, but it can make you more susceptible to bad things. And it does lead to dementia as well as so many other things. And I beg her, and her dementia is getting progressive. In fact, yesterday I talked to her and I said, you haven't done the testing that I need. And she's like, well, we're just going to go to Mayo. I'm like, okay, we'll go to Mayo. But she goes, I need genetic testing. I said, I've already done your genetic testing. I've done the Bredesen. I know what Dr. Bredesen, what we need to do. And won't test her home. Like she won't. And then I had another friend that came in right after that. And she was like saying, hey, so-and-so is really bad off. I said, I know, I just talked to her. And I said, I think she has mold. And I know she has mold in her home. And she goes, oh my gosh, she does. You can see it. You can smell it. They're living in it. And both this patient and her husband are both getting progressive dementia. And they don't want to do anything. She's like, well, I don't want to leave my home. I don't want to leave my home. And she's got enough money to move somewhere else, but she's just in denial.
So it doesn't always have to be a situation where we leave permanently. It's
So,
just a matter of being out of the home until the issue gets resolved. Sometimes, yeah, and folks, we come across this all the time. It's now my home is fine. I don't see anything. I don't smell anything. This patient, I guess you can see it. Do you ever have them do some sort of like a DIY screening that would kind of open their eyes a little bit to make them a little more open to actually having something more thoroughly done?
yes. And so what my protocol is, again, one of my first things after I do the meet and greet, they come in as start doing the workup. I will highly suspect that they may have, we got to rule it out. So I'm like, okay, let's test you. And so I like to do what they call a real-time lab. It's a dust test just to check the mold. It's a readiness mold index test. That's an environmental company does. And it's just a cloth. And just go get dust, out of the air vac, just kind of, you want to just test the home. Let's just do a little quick screening with that. And while we're doing that, let's go ahead and test you. So I do a urine mycotoxin. So we know that mold makes toxins, and the toxins are what's causing the problem. So if it's in your body causing a problem, we can mobilize the toxins. And I like to use what they call glutathione challenge. Now, glutathione, if people don't know that word, glutathione is a molecule made in our liver to help us detox. And so it's a big molecule because it's made of 3 amino acids. And so we now have a liposomal glutathione that I keep keep it refrigerated, and I get them to pump it under their tongue a couple of times a day for about 5 to 7 days and really start mobilizing these toxins through their liver, through their, the gallbladder, throughout their body, and then even sweating the night before we do the test to help even more so move these toxins. And then the morning urine that we get, like, at the end of this glutathione challenge at 5 to 7 days, we get a better, hopefully, better concentrated urine of mycotoxins. And so these are my 2 ways of testing. I test the home with the dust initially, and I do the person's urine mycotoxins. Myco means yeast or fungus, of course, toxins. So these bad molds that I call them, there's 5 classifications that we test for that are from water damaged buildings or, high humidity buildings, mold overgrowth that releases these invisible toxins that we breathe in. And then once we're breathing them in, or they get on our skin even, or in our eyes or mouth, whatever, you get it into your body, then these toxins get in kind of habitat with us, releasing these toxins that start breaking our body down. So we want to test that so that we can fix it. So that's what I do, is the urine test for the person initially. And this is my DIY testing, I guess you would say, the home and the person.
Very good. I'm glad to hear the environmental mycotoxin testing. We understand certain molds can be allergenic from that standpoint. In fact, if you have a histamine response to molds, then just about any mold can do that to you. But it's these molds that produce these toxins that can help create some of the chronic issues. So I think that's a very solid test. I've worked with Dr. Hooter at Real-Time Labs for years. In fact, as you probably know, I sat on their board. We actually have a patented process for removing the mycotoxins from the structure and contents. And we can talk more about that later on. But that's kind of what we specialize in. So that environmental mycotoxin testing, there's actually several companies now that do that. Besides Real-Time, there's a couple other labs that do that. So I think that's absolutely great. That's part
I think you just get used, what works and what's easy and what's been kind of tried and true for, helping, keeping things easier instead of, I've been through the complicated learning of all this stuff, and you just kind of funnel down and find out what really works. But, that's why people don't, and that's why I want people to understand is that mold, the water dam mold or the mycotoxins are damaging the body. That's where the word CIRS came from. Dr. Richie Shoemaker said the CIRS is chronic. The C stands for the CIRS. Means chronic. The I is immune. R is response, and then S syndrome. That's where CIRS came from. So it is a chronic immune problem. So I will run blood work, and if some people have a positive ANA or some kind of autoimmune, they're having gut issues, what I call the leaky gut, like they're having a lot of either constipation, diarrhea, bloating, reflux. And then if I kind of do like a little quick, little easy through Quest and delayed food allergy testing as well to kind of show people that it's IgG, the IgG allergy is the delayed allergy. IgE is when you have a quick allergy, like if you eat, people who eat a peanut and they're allergic or something, they get anaphylaxis or they get a reaction. That's not the one I'm testing for. I'm testing for the delayed onset, which comes from leaky gut. And leaky gut is when the gut barrier is broken, and then bigger molecules go from your gut into your bloodstream and set up these immune complexes. Well, I can test people's delayed food allergy test. And if they're lighting up everything lights up as positive, I'm going, okay, it looks like you have leaky gut. And leaky gut can come from a number of things that we put in our gut, but mold is one of them. The mycotoxin is one of them. And so I'm like, okay, I like to do a stool test looking at the microbiome, the advanced stool test, not one that you would send to Quest or LabCorp, but one of these advanced functional medicine. And there's a lot of different ones out there that I use. Genova has GI Effects. I like GI Map from another company, and then, Tiny Health. So I'm using all these, I look at all these different functional labs, but I really like to look at the microbiome. And so if people are having an imbalance in their gut, I'm like, okay, well, what's causing this? And going back again, I'm not trying to blame everything on mold all the time, but that's one of the big things I do look for.
Yeah. A couple of things I'd like to add to that. When you're having your patients do that testing, that dust collection, and we just did a podcast series on DIY testing. And so when we're doing that dust collection, it's really easy to get what's known as sampling bias. So if I'm going to go and sample somewhere that doesn't look, I've got white fuzzy or brown fuzzy in the wall, I'm going to sample right there. That'll turn around and may give you a positive sampling bias. Well, if I sample my credenza bacteria that gets dusted every week, then I'm going to get a negative bias. And so there runs, if you do that composite sample like that, there is a risk of getting sampling bias. So one of the things that how we sample when we do or perform environmental PCR sampling or mycotoxin sampling, we're going to sample from the HVAC filter. And there's a couple of reasons why you may want to have your patients do that. One is that we know that inhalation is one of the primary pathways for that exposure. And so that really gives them a good indication of what they're breathing in because it's in their air filter as a collection. It also is a great way of giving them a composite sample and eliminating some of that sampling bias from going here, and here a sample. And the third reason why that may make some sense is that, hopefully that filter hasn't been in for the last 3 years. And so oftentimes when people sample, they'll do for a while, the big craze was sampling underneath the refrigerator to get a good dust reservoir. Maybe on top of a cabinet that hasn't been cleaned in a while. And so really what you're doing is you're getting a core sample over the last 3 years or 2 years or whatever, and not really indicative of what's going on in today's technology in your home. So we'd recommend that you sample from the HVAC filter as a single sample. So you may want to.
Well, that's a good thing. I appreciate you telling me that because I love that idea. I think it sounds so smart. And so I'm going to start telling, my patients to do that because I was getting them to test on top of the ceiling fan blades, which, like you said, that's you never know, like how long that's been there.
Yeah, we've seen ceiling fans that you can make a sweater out of that stuff. So, and then the other thing is that when we're talking about these kind of screening sort of tests, or any test, there isn't one test, and we've talked about this ad nauseum on some of our prior episodes. But it's important to understand each test has its strengths and weakness, and there isn't one test that's a kind of a silver bullet or panacea for all tests. And that's why we can get into what a good inspection should entail, but it's going to be, that one test tells you that one thing that it's trying to solve for and look for. And so a layered approach really is probably once they advance to getting an inspection, that's a good maybe jumping off point, but a good inspection is going to have multiple types of tests to make sure you cover all of the bases.
Well, I appreciate you saying, and because I know, like I mentioned to you in the past, is that my frustration is finding the right people to test. And, thank God you said you trained someone up in my area now that I can start using, because that's the whole thing, is getting people who have been to the conferences that we go to. That for people who have chronic illness, and and I hate to say it, I mean they're nice guys, and I know they mean well, but around here, some people who say that they're mold inspectors, whatever, are not trained in these conferences, and they're especially not trained for people who are sick. And so you really need someone who's not going to give a false sense of security like I had personally. And you do need someone who understands all of this and is trained and knows how to really look for it the right way, and definitely not just do air sampling, the little tripod with catching the spores in the area. If I tell people all the time, if someone comes in and says that's how they're doing it, you need to get rid of it. That's not reliable. I mean, that's what happened to me, and that didn't work. So yes, I mean, that's why I want to find, I'm glad that we reconnected. Like I said, I knew about you in the past, but when I met you at one of the meetings a couple of years ago, I was like, yes, I'm gonna start using you up in the panhandle of Florida. And then y'all had a hurricane 2 days later that just wiped you out. So well, they're going to be busy.
Yeah, yeah, that does happen. We worked really hard to put together in the last 18 months an inspector network of certified inspectors, and we have software that we can actually, when they're on site, we can actually see the inspection in real time, and we do our intakes. We guide on here's what type of samples we recommend get be taken, whether it's intracavity samples or surface samples or air samples actually have value. Yeah, they have limitations, but they have value at that to a certain extent. And then also, hey, do we need to do mycotoxins? We find a lot of our practitioners are working with folks that are chemically sensitive. And so we do a lot of chemical testing, like for formaldehyde or benzene, things like that as well. Do you see that in your practice?
Yes, I do. And I think those VOCs, the volatile organic compounds
Hmm.
really affect people, but people who are very chemically sensitive, for sure. I see that a lot. I mean, there's just so many things. I guess I didn't go through the whole list of things, but I mentioned some of the symptoms that I initially see people come in for, but then I start really delving into people that have histamine reactions or that the MCAS, or what we call POTS, where they get up and they're dizzy and they're lightheaded. I mean, all those things, people come in, they're kind of like mystery symptoms that a lot of doctors don't understand. And when people come in, you know, people don't ask about those kind of symptoms. So there's a lot more that people don't get asked in their intake. And so, yes, I do ask about chemical sensitivity and like I said, histamine reactions that people don't even realize what that is. Like when I say histamine, like a lot of people can get headaches or rashes or heart palpitations. And, there's just all this stuff can be connected to mold mycotoxin in people. And so that's why a lot of people just don't know because they don't know who to go to, who to look for. And, doctors like me, like I've been the only one in my area that has studied these kind of things. And it's not doctors' faults. They're just stuck in a system that we were trained in. And unless you kind of go outside of that box and really start learning, and I'm just perpetually always learning and my interest is always peaked. But I feel like this is my purpose in life, is to help people with these more, I guess they call mystery symptoms. And that's what I like to do. I love trying to figure things out. I mean, really my niche, I like to say, is early detection
Hmm.
and, for longevity. I mean, that's it. Early detection, longevity medicine. And I even wrote a little book that, because I want to stay smarter, stronger for longer. And doing a functional medicine approach really does this longevity, healthgevity, if you want to call it, not, I want to, I want to live longer and have a good mind and stay strong and healthy. And that's what I want for my patients. So, yeah, I mean, that's my whole goal. I don't want to end up like my mother, my sweet mama. She, brilliant lady, just watched her decline like crazy into dementia. And, I've got Parkinson's on both sides of my family. So I know I'm high risk. So I want to know as much as I can. And as I'm learning on myself, I'm able to teach to my patients.
Yeah, I think that's critically important. One of the things that I was thinking as we're having our conversation, that there's a big trend in concierge medicine that a lot of practitioners are going that way because that insurance model is somewhat limited and maybe not as patient focused as what it needs to be. And why this is an evolving trend and more doctors are going that way. For you, it's actually kind of getting back to your roots of what you grew up with. So this isn't anything new. It's back to the basics. Your practice.
Yeah, that's what I say. I have a small town approach with modern day technology.
Yeah. One last thing I wanted to cover, and we talked about this a little bit before we started the episode, was cost. You mentioned folks don't want to leave their house. Do you find that sometimes too folks really don't want to spend the money, or they're afraid the cost is too high to really understand what's going on? Is that a factor that you find with a lot of your patients?
Yes, it's huge. Yes. And that's like when I'm just talking about the lady I just talked to yesterday with dementia, she's just like, I've been in this home for 40 years. Like, well, maybe that's the problem, with the water damage. But people don't want to leave. It is hard to get people to uproot, from their home. I mean, I've been through it here and it is a lot. It costs a lot. It's energy taxing. But I tell people, if you want to have longevity and healthgevity and to live optimal health is what I do, optimal health, you've got to push a little bit just to get better. It is hard and I understand it. So that is an obstacle that we have to work.
Well, let's maybe dig into that a little bit and what costs should be. Now, if you already have them do their environmental mycotoxin testing and be sampled appropriately, that's something that is a good foundation and for the next step. So for your patients, there's a few things that they should expect from a good inspection. A good inspection tells us the what. That's going to be for the laboratory data. What type of contaminants do we have? Is it VOCs? Is it mycotoxins? Is it endotoxins? Is it bacteria? Is it fungal? Those sorts of things. So it's the what that comes from the lab. The where is really comes from that visual inspection. And a good inspector, you mentioned a pipe leak that was undiscovered. So a good inspector is going to have some tools out there, like using infrared thermography that measures temperature differentials. And since water heats and cools at a different rate, it can help you identify some of these hidden causes that really you can't see with the naked eye. So the what, the where, and the why it's there. You should be going in and measuring the relative humidity inside the home. They should have a moisture meter when they see maybe drywall that's popped or prior water stains, etc. They should be measuring that. And then on the sampling, they can do intracavity sampling. So if we suspect there's mold behind a wall, you don't have to necessarily tear out the wall, but do an intracavity sample. For us, that's about a 95 sample, and it's way cheaper than repairing a wall that didn't need to be demoed, but getting good data. And the last thing is that inspection should give them the how on how to resolve their issues with a good, thorough report. So the DIY screen you're doing, I think, is fantastic. Then at the next step is going and getting that really professional assessment. And there's a lot of tests that can be done. That's where a good intake will understand what the issues are. And then you got to be flexible on the ground when you see, hey, we had water stain that you didn't know was there. Maybe that's our hidden reservoir. So be able to test for that. And it does not have to cost an arm and a leg. A general rule of thumb, depending upon the size of the home, for thorough testing, we're talking some PCR or DNA testing for toxigenic or fungal or pathogenic fungal species, environmental mycotoxins, surface and air samples. Generally, you're going to be talking about $1 a square foot, sometimes a little bit less if the house is bigger. I've heard stories of there's companies out there that will go unnamed that are charging, $10,000 for an inspection on a 2,000-3,000 square foot home. And we all use the same labs for the most part. And so that's just ludicrous, in my opinion. It doesn't have to be that way.
Well, that's what happened to me is I, didn't know. And I used, a company, a very good company, but it was very expensive. So that's good to know that there's more cost effective, reliable companies.
Yeah, you do get
Like
what you pay for oftentimes, but there's not always, you don't have to compromise quality to get a good inspection. So hopefully that'll help
Well,
some of your patients.
yeah, that's going to help. But my thing too is, like I said, I value people like you that understand it, that have gone to the conferences, understand people that are chronically sick. That helps us as mold literate doctors, and that are taking the consideration of people's finances. So definitely going to be using you.
Yeah. I think you and I initially met years ago at the International Lyme Associated Disease Conference. I think we're in DC this year. Are you gonna? Is that on your calendar?
I have so many conferences that I'm doing now that as much as I love the Lyme community, the iLads, and just love everybody there. This year I can't, but I've enjoyed learning about everything. I mean, that's another chronic illness that, takes, it's another tough one that, so many people are affected.
Yeah.
And like Dr. Neil Nathan always says, and I hate to even, but he always says, if people have Lyme, there's a couple of things that you want to do ahead of time, just bringing this up since we're mentioning it. But one of the things is make sure that people aren't exposed to mold or have mycotoxins, because that's huge, because that's that immune response that causes Lyme to keep going. And I'm just going to mention this too. The other thing with mold and Lyme people is the anxiety and doing what they call the limbic part of the brain, that part of the brain that keeps the anxiety and the fear, is that reptilian part of our brain. There you have to do a lot of retraining that limbic system and the vagal system to help bring that down so your body can heal, because we can go into that. That's a whole nother topic about the cell danger response and all. But I'm just going to say that if people have a lot of anxiety, there are some training programs online for limbic or vagal or both training that really, I will get people on that first if they're having major anxiety because they can't heal unless their limbic system is calmed down.
I think what you just did is led to a great segue. We need to have you back, and let's dig into
Oh,
that when we have a little more time, because that anxiety is really it's true. We just had a podcast episode that dropped, I think, yesterday with another provider here in Florida. They calls it the dynamic duo, I think, Lyme and mold. But yeah, if you would love having you on the show today, let's maybe sync our calendars and dig into that a little bit next time.
okay. Well, this was wonderful, John. Thank you so much because this is such a much needed topic and doesn't get talked about enough. And we really need to educate people. And I really think that this is great. The more information we get out, the more people listen to this, the more people learn about it and know that this is a real thing and it's scientifically proven and there is help. And I've transformed so many people from being so miserable and chronically sick into a great, functional, good, long, healthy life with optimal health.
That's fantastic. There is hope. I think that's one of the things we try to end every episode with. There is hope for this. So,
and I do a little plug just on my book. It's just a little ebook even on my website. They can download the PDF, but I just call it Smarter, Stronger, Longer. It's just a little bit about if people want like a little quick topic. It's easy read.
easy to the point. I was just getting ready to ask for people, for everyone that's listening and they want to learn more about you and your practice. How can they get a hold of you? What's the best way?
So my website is www.drmyrareed. That's DRMYRAREED.com. So my website's really good. I have a lot of social media channels, but I'm really working on my YouTube channel right now. I'd love for people to start following my YouTube. Is Dr. MYRAREED. So yeah, I would love to get some followers on my YouTube. I'm really starting to build that and going to be doing a lot of education. So I'm building that up right now too.
That is fantastic. We'll make sure we get all those socials posted. That way everyone can see them when we launch the episode. So we'd like to thank everybody for listening. If you'd like to learn more about environmental testing or mold remediation or mycotoxin removal, you can always visit us at www.themoldpros. That's THEOLDPROS.com. If you found this episode helpful, please subscribe and leave a review. Or even better, share it with someone who's dealing with environmental exposures. Someone that may have a mold problem or just have some questions about proper mold inspections or proper mold remediations. It really is a big help in getting this information out to reach people who need it the most. We think that empowering people through education is really critical and enables them to make the right decision for themselves and their families. So this is John Bodie. You've been listening to Mold, Mycotoxins, and More, and we will see you next time.
You've been listening to Mold, Mycotoxins, and More with John Bodie. If you're ready to take the next step towards a healthier home, follow the show and visit themoldpros.com for your free consultation. Because clean air is the first step to true healing.